What is breast cancer?
Breast cancer is a disease in which cells in the breast grow abnormally quickly and form a tumor or lump. These abnormal cells can then spread to surrounding tissue or even to other parts of the body. Metastasis. How does it start? Breast cancer usually starts in the milk ducts or in the milk-producing glands. Main features: uncontrolled growth of breast tissue, mass, lumps, large lumps, with lumps, risk of spreading to other tissues. Why is it important? Breast cancer is much more likely to be treated if it is caught early. That's why regular screening and awareness are so important. Common symptoms of breast cancer: new lump in the breast, a hard lump in the breast or under the armpit, usually painless, but sometimes there can be pain. New lump in the breast in breast cancer. A new lump in the breast is one of the most common and early symptoms of breast cancer. Cancer cells can grow abnormally and form a hard lump of tissue in the breast, which can be felt as a lump. Characteristics of cancerous lumps: usually feel hard, may be irregular in shape, does not move easily, stays in one place, most often painless, may grow slowly over time. Where can they be found? Any part of the breast, near the nipple, under the armpit, if it has spread to the lymph nodes. What other symptoms may accompany the lump? Change in the size or shape of the breast, inverted nipple, blood-tinged discharge from the nipple, orange peel skin, redness or swelling in the breast. When should you see a doctor? If you feel a new lump and it does not go away within 2 to 4 weeks, or if the lump is accompanied by any of the above symptoms, you should seek medical advice immediately. 2. Change in breast size or shape. One breast appears larger or misshapen than the other. Breast cancer. Change in breast size or shape. A change in breast size or shape is an important warning sign of breast cancer. When cancer cells grow abnormally in the tissue inside the breast, the normal structure of the breast can change. What kind of changes can be seen? One breast becoming larger or smaller than the other. Breast shape becoming distorted or uneven. Part of the breast being pulled inward or sagging. Breasts becoming droopy or unusually hard. Why does this happen? Cancerous tumors can invade breast tissue or destroy the internal structure, changing its shape. Sometimes it can also affect the skin and nipple. What symptoms may be present? A lump in the breast, a nipple that turns inward, an orange peel-like change in the skin, redness or swelling, unusual discharge from the nipple. When should you be concerned? If the shape of the breasts changes suddenly or gradually and does not return to normal within a few weeks, it is important to seek medical advice immediately. 3. Skin changes. Dimpling or pitting of the skin of the breast, like an orange peel. Redness or swelling. Breast cancer. What are the changes in the skin of the breast? Breast cancer can cause some unusual changes to the breast skin. These often occur gradually, so it's important to pay attention. Orange peel skin, peau d'orange. The skin of the breast becomes thick and pitted, a lump that looks like an orange peel. This is caused by a lymph fluid block. Redness of the skin. Redness. Parts of the breast or the entire breast may be red. Sometimes it may feel hot and swollen. Tightness or firmness of the skin. The skin is tighter than normal. Soft is considered normal. Dimpling or pulling on the skin. Small holes or ridges in the skin. Like dimples in a smile. It can look like this. Sores or ulcers. Ulcers or wounds. The skin on the breast may be sore. Does not dry out or heal easily. Increased skin thickness. The nipple may become thicker than normal. can be felt in the hand. Changes in the skin around the nipple. The skin around the nipple may become rough. The nipple may move towards the side. When should you see a doctor immediately? If you have any new skin changes, redness or dimpling that lasts for several weeks, a lump in the breast. 4. Nipple changes. Inverted nipple, changes in the position or shape of the nipple. Breast cancer. What are the changes in the nipple? Breast cancer can cause some unusual changes in the nipple. These often occur gradually, so it is important to pay close attention. Number 1. Inverted nipple. The nipple turns inward suddenly or gradually. Even if it was normal before, such changes may occur later. Number 2. Abnormal nipple discharge. There may be bloody or brown discharge. Sometimes a clear or watery liquid may also come out. More than one side of the nipple. Number 3. Cracked or sore nipple skin. Itching or peeling around the nipple. If the sore is not easily healed. Number 4. Change in the shape or position of the nipple. The nipple is pulled to one side or becomes curved. Change in position compared to before. Number 5. Nipple pain or discomfort. Long-term pain or burning. Discomfort when touched. Number 6. Redness or swelling around the nipple. Areola, the dark area around the nipple, is red or swollen. Skin may feel hard or hot. Breast or nipple pain. Long-lasting or unusual pain. Breast cancer. Pain in breast or nipple. In some cases, breast cancer can cause pain or discomfort in the breast or nipple. However, the important thing is that most breast cancers are painless in the beginning. When is pain more of a concern? If the pain is only in one breast? If the pain is long-lasting, more than 2 to 4 weeks? If there is a lump or other change with the pain? If the pain is gradually increasing? How to reduce risk of breast cancer. Breast cancer cannot be completely prevented, but following some good habits and lifestyle changes can greatly reduce the risk. Regular exercise. Walk or exercise for at least 30 minutes every day. If the body is active, there is a hormonal balance. Eat healthy food. Eat more vegetables and fruits. Eat less fat. Eat less processed food and fast food. Keep weight under control. Excess weight can increase the risk of breast cancer. It is important to keep BMI normal. Avoid alcohol and smoking. Smoking increases the risk of cancer. The less alcohol you consume, the better. Regular breast self-check. Examine your breasts every month. See a doctor immediately if you notice any lumps or changes. Breastfeeding. Breastfeeding reduces the risk to some extent.